Hi everybody, this is Dr. Ty Vincent with another LDI-based video, this time on eczema. So eczema is not just one type of condition. Sometimes that term is used to describe things that are not actual eczema. It's just red, irritated skin someplace, and sometimes there's a reason for it. You have a contact with something that made your skin break out, and then you got a rash there. That's not eczema. That's what we call contact dermatitis. You touched a thing, it gave you a rash, and you know that's why it is where it occurred, and you know what happened, and so it's not the same thing. Eczema, the medical term is atopic dermatitis. Atopic means it has no location. It, of course, does have a location. It's on your skin. That's why you went to the doctor about it. But the location where it's occurring on the skin isn't based on contact with anything, and it's unexplained, right? So we don't know why it is where it is. That's the atopic word. And then the other is dermatitis. Dermatitis just means inflammation of the skin. So there's redness, there's itching, it can crack open, it can weep, it can get crusty, it can bleed, it can be really, really miserable. I've seen children in my practice who look like they were set on fire, his head to toe, and they just look like a burn victim, some whose hair won't grow in on their head because of this constant horrendous inflammation of their skin. Your skin is, by weight, your largest organ in your body, of your body, it's not in, but it's your largest body organ as a collective tissue. And if you inflame that whole thing, kids won't grow, for one thing. You're going to be very sick, very miserable, your life is horrible, and if you have a child with this, they scream and they cry and they itch and they scratch all night long. You slather them with Vaseline or put whatever other ointment the doctor gives you, and sometimes it just seems like a complete waste of time. They're just absolutely miserable. So this condition can go from one little mildly itchy, flaky patch behind your knee to just a horrendous disabling condition that's murder for the whole family. So it's a fun thing to treat because it relieves a lot of misery for people when we can get rid of this. And there are now drugs on the market you're seeing on TV that are immunosuppressive in general, that they're suggesting for people with eczema, because eczema has become such an increasingly common problem. Like every other allergic and immunological disease in our society has become more and more prevalent. So they're marketing systemic immunosuppression for some people with eczema. That's a terrible way to go. So hopefully I can explain to you another avenue of treatment that has a high degree of success and infinitely safer and less expensive. So what I can tell you about eczema in general, atopic dermatitis, is that it's an allergic disease. And it's always been seen as such. It's just that what the person's allergic to often remains a mystery. Doctors are not good at figuring out what the triggers are for different people. They may have taken your child to an allergist, or say you went to an allergist and did skin patch testing for foods and this and that, or airborne allergens, sometimes maybe dust mites, things of that nature. And they might find certain things that light up, and then you try eliminating them or avoiding those exposures, and it may or may not make any difference at all. Allergy testing is just not very good. It's not very accurate, it's not very comprehensive at finding everything, and it's not always that easy to avoid every food that shows up. So that doesn't always work for people. And even if it does, if you find out that you or your child is allergic to half a dozen common foods, then it makes your life miserable trying to avoid those foods, right? So that you don't have eczema. Putting steroids on the skin to manage it has its own risks associated. The skin thins out, you lose pigmentation, so it has its own problems. You can't do it on the face because of that thinning of the skin factor. And then there are these immunosuppressive topicals like Elidel and Protopic that have their own interesting side effects. So if we can address this problem at its root cause, so the allergic process, like what are you reacting to that is causing this manifestation on the skin, right? And it could cause eczema in one person, and if it's a food sensitivity or an environmental sensitivity or something, it could cause asthma in somebody else, or inflammatory bowel disease in a different person, or arthritis in another person. So this is just the way your body's immune system chose to react to whatever this is. Which is why somebody just saying, I have eczema, what antigen is it, is a useless question. That doesn't tell you. It's not specific. And so it's a non-specific immune response. You have to do some more detective work to figure out what might be contributing to it. And it's also, in many cases nowadays, multifactorial. So it's not necessarily one thing. Most people who have eczema, it's a food sensitivity issue, at least in part. It's pretty uncommon that I see somebody with really bad eczema where they aren't reacting to foods, at least as a contributing partial factor here. But sometimes that's the case. Sometimes it's some external exposure and it's not an internal exposure. But the majority of the time it's food sensitivity, at least in large part. So one of the first things we tend to use with people is the food mixture, even if you're not aware of any foods that actually aggravate it. Because eczema is not like hives, where if you eat a peanut and you get hives in 2 minutes, it's pretty obvious. Oh, I ate a peanut, I got hives. And next time I eat a peanut, I get hives. And you start to put two and two together. Eczema usually is a manifestation of a more gradual and delayed immune response. So you might eat a certain food 2 or 3 days in a row, and then a couple of days later, you develop itchy, rashy skin. And you can't really make the connection because it doesn't happen right away. So most people that have eczema are unaware of the foods that set it off, or at least unaware of some of them. So in most cases, we start with the food mixture. Unless you have awareness of other allergic exposures that clearly aggravate this. Like if you have an animal reaction. I've seen kids who are severely sensitive to dogs, and if they get around a dog, especially if the dog licks you, oh my gosh, horrible rash shows up at the point of contact. Just being in the room or where there was a dog that sat on the couch and then you sit on the couch, you might itch all over, develop eczema. So you can have airborne reactions. And it doesn't have to be animals either. It could be dust mites. Dust mites are a very, very common environmental allergen that can give you atopic dermatitis. And in those cases, most of you or your children will have the most severe itching and scratching at night when you're in your bed, because your bed is where you have the most density of exposure to dust mites. So if there's anybody out there with a kid who's, so during the day, they have the rash and whatnot, but the itching and the crying and the, real misery is typically at night, is at worst. They may have dust mites as one of their sensitivity reactions. Just so you know, first thing in the morning or through the night. So that's a common environmental one. It can be mold that can do it to some people, or pollen season, or different things. So when I talk to people, I try to sort out what are all these factors that have some influence on it, and we compile a list. Okay, foods sound reasonable, environmental might sound reasonable. Some kids react to fungi that live on your skin. So I made another video about psoriasis. Psoriasis is a potential autoimmune manifestation of an immune response to skin fungi, just normal fungal organisms that live on everybody. But if you develop an allergy or an immune reaction to them, you end up with skin inflammation of some kind. And that can manifest as eczema also, not psoriasis, but eczema. When people have significant eczema on their face and head, a significant proportion of them are allergic to yeast, to candida type of yeast, which likes the kind of oilier, sweatier, warmer areas of the skin. So yeast can sometimes play a role and be an antigen we have to use. I have a skin fungi mixture that's a bunch of other filamentous types of fungi that occasionally is key to resolving somebody's eczema if it doesn't respond to foods and environmental triggers, or those don't make sense. And so then foods and airborne triggers, those are the most common ones that I see having significant benefit here in people with eczema. And beyond that, it's rare that anybody actually needs to go beyond those four things. I've seen a couple people that have partial condition responsible or reacting to bacteria. So you can have skin bacteria also that are a target for your inflammation. Those people are usually going to have what looks like infected eczema. So their eczema isn't just flaky and red. Their eczema is cracked and weepy and has like a golden crust on it all the time. Those people might have developed also a bacterial sensitivity reaction, because that's what the immune response looks like when you get bacteria involved. Think about impetigo. If your kid, or you've seen a kid who has had impetigo, where they get like a crusty, it looks like eczema, but it's contiguous with their nose or their mouth or both, like a red patch that comes off one side of their nose or mouth, and it gets kind of eroded and crusty and weepy and nasty, and you can treat it with antibiotics. But in a lot of these kids, it'll kind of recur periodically. One of my children gets this impetigo, and that has resolved in every one I've treated so far with the skin bacteria mixture. It looks like eczema, but the location tends to clue you in, and so we give it a different name. It's impetigo. We know it clears with antibiotics, but your eczema could be on your wrists or behind your knees or your elbows or some other place and look like that. And so when I work with people, that's the kind of thing I want to know. Do you get different kinds of eczema in different places of your body? Which one started first? Are you aware of any associated factors or triggers? It can be a somewhat complicated thing to sort out, But when there are only 5 or 6 antigens to try, and when you have a skin condition, it's very easy to see when it gets better. All of these antigens that are involved here, for the most part, have fairly narrow dose ranges to work in too. So it doesn't take forever to solve the puzzle now that I have a lot of experience treating it, and I have a lot more awareness of what different antigen triggers kind of look like, the subtleties of it. So if you or your child or somebody you know has a problem with eczema, this is something for sure I would recommend that they look into and consider. Low-dose immunotherapy, the technique that I developed, that I use, or other forms of immunotherapy, sublingual immunotherapy, NAET, LDA, provocation, neutralization. There's more than one way to skin a cat here. But there are a variety of ways to reestablish immunological tolerance. And if you have a skilled practitioner, they should be able to help sort out which triggers you have and how to go about putting out the fires for you to resolve this problem. So I would suggest you look into it and do our best to help. Thanks.